My name's Kayla. I have the privilege of introducing our next speaker, Dr. Angela Diaz. Dr. Diaz is the Dean of Global Health, Social Justice, and Human Rights, the Gene C. and James W. Crystal Professor in Adolescent Health, Department of Pediatrics, and Department of Environmental Medicine and Public Health, and Professor, Department of Global Health and Health Systems Design at the Icahn School of Medicine. After earning her medical degree at Columbia University College of Physicians and Surgeons, she completed her postdoctoral training at the Mount Sinai School of Medicine and subsequently received a Master's of Public Health from Harvard University and a PhD in epidemiology from Columbia University. Thank you so much, Dr. Diaz, for joining us.
Good morning. So I'm really excited to be here with all of you. I would like to, the goal of my presentation is basically to describe the Mount Sinai Adolescent Health Center, which is an integrated model of services for young people. And I would like to really help you understand the breadth of our model and how we integrate our mental health services, behavioral and mental health, Article 31 and Article 28 into the work that we do. And I have no financial conflict of interest. To begin with, I would like to really go over the patient demographics and their background so that you see the population that we serve. At any moment, we have 38,000 young people in our patient roster. We serve young people ages 10 to 26, and that is through age 26. It's until the day that they turn 27. So it's a very broad age. So they spend a lot of time with us. And every year we serve at least 12,000 patients. To give you a sense of the age of our patients, our young people, you can see here that the majority are ages 15 to 17. So they're really youth. But we have a large distribution between the 10 to 26. The one that you see here, 0 to 9, are the children of teenage parents or young parents. We have a young parents program where we see the teen parents and their children as a family unit at the same time. The distribution of our population is that we have 75% cis and trans females and 25% cis and trans males. And we actually have a large program that helps young people really become who they really are. So we give them the puberty blockers, the sex hormones to help the young people become who they are. In terms of race and ethnicity, we serve whoever comes to us. But 94% of our youth are youth of color, because in New York City, race, ethnicity, and class sort of go together. And we know that people of color or people from low income do not have access to the high quality care that they should have. So our youth are Black and brown, and even the ones that are mixed race are usually a mixed race from Black and brown. Most of our patients reside in low resource communities within the bottom 10 of New York City's 42 neighborhoods with lower health indicators. And these are neighborhoods with inadequate investments. Traditionally, they have been really neglected in terms of investing in these neighborhoods. And because of that, the young people are impacted by the social determinants of health with resulting disparities and inequalities. Approximately 98% of our youth are low income. As I say, we see everyone. Some of the kids, the parents make millions of dollars and we think they have the right to be served and we don't charge anyone. But we cater to the young people that we know traditionally do not have access to this type of services. Most of the youth that come here are uninsured or underinsured. And we have sort of become one of New York City's safety nets for low-income uninsured youth. 33% of our youth have Medi-Cal or Medicaid, as we call it in New York City. And about 12% have private insurance. But usually we do not process them because the insurance company send home the explanation of benefits or EOBs to the person that owns the policy. And sometimes the young people are coming to us confidentially. So we just want to make sure that their the right to confidentiality is honored. So what we do is that we raise money to be able to serve everyone without having to process their insurance. And we can discuss that further if you would like during the question and answer. We don't have a catchment area. We are part of a major hospital in New York. And usually hospitals have catchment areas or areas that they serve, especially for low-income communities. But we are here, and any person aged 10 to 26 can come from anywhere. They can come from Utah. If they come to New York and just show up in our door, we will serve them. They can come from Africa and come into the airport and take a taxi to our doors, and we will serve them. We just want to really make sure to serve any young person ages 10 to 26 that want to be served by us. Within New York State, the youth come from 19 different counties. So they come from a very vast area, 7 of which are rural. And they come from all of the 5 New York City counties, all the 5 boroughs of New York City. This is a map of New York City. Where this X is where our program is located. So the program is located in the island of Manhattan. But you can see every black dot is where the youth come from. So across the Hudson River here, this is New Jersey. So they come from other states, as I mentioned before. And you can see that they come from all over, literally, New York City. And the heaviest concentration, the darker the areas, mean that more youth come from those areas. And if you know New York City, you will realize that these are the areas that are lowest income. So basically, Upper Manhattan, Lower East Side, the Bronx, especially the South Bronx, Central Brooklyn. So we really are providing access to population that usually do not have access. These are 4 of our youth. So they, the youth are very diverse. Now I want to go over the description of the model, but I want to start with our vision. And our vision is to help young people reach the promise of adolescent and young adulthood, and to be resilient, happy, healthy, and well-educated, with hopes and opportunity at the present and the future. Sometimes when people talk about youth, they talk about their future, but we need to remember the present. We need to provide what they need now, in addition to the, making sure the journey to adulthood is good. And we really believe also that young people deserve to be physically and emotionally healthy, and the high quality care is the right. And we feel that it's our responsibility. That's why we do whatever it takes to provide these services, to make it adolescent friendly, to really make it easy for the young people to come. So this is the vision. The mission is to break down racial, social, and economic barriers to healthcare, health, and well-being for young people by providing vital services, high quality, comprehensive, integrated, confidential, and at no cost to them for all who come to us, as I mentioned before. We provide these services to promote equity and within the frameworks of racial, social, economic, and sexual and reproductive justice. And what I mean by that is, as I'm sure you know, like in the top frame here, everyone is getting the same size bicycle, whether they can use it or not due to their size or ability to use the bike. So it doesn't work for some people. It may work for, a segment of the population. At the bottom, people get the bike that they need, that they can actually use, that is appropriate for their size. So our program is based on equity, giving every young person what they need when they present to us. And it's a very tailored way of working with youth. And here, just to give you the full range of what is happening, the first one here, which is the reality of our healthcare system in the US, that I often say that the healthcare in the US was created for adults, by adults, and then we try to fit young people into that system. And when it doesn't work, we call them non-compliant and hard to reach. When indeed, what is hard to reach are the services, the way they are designed. So the reality in the US system, he's here all the way to the left of the screen, is that some people that need services don't get it. They don't have access at all. Others get a little bit, and others get a lot of it, whether they need it or not, especially if they can afford it. So it's a system that is really not, the distribution of the services is not equitable. Sometimes people go to the doctor, and inequality here, everyone get the same thing. But we cannot give everyone the same thing because not everyone is at the same level. Some people really come from neighborhoods where they had not gotten their health taken care of. They had not had the access to the mental health or the physical health or the sexual health services that they needed. So they are at a different stage. So the equity here is what we do. We give every person what they need depending on where they are at that particular moment. And then we work with them over time. But we are also, as I spoke before, our frame is justice. What we are also working on, in addition to the services that we provide in an equitable way, is to really work on system, to advocate, to try work on policies that remove the barriers so that everyone from the beginning can really get what they need and maximize their health to really achieve their potential. And eventually, I'm hoping that we can achieve that. But this is very important. And that's why a targeted approach is very, very needed. Our model is integrated, is trauma-informed and healing-centered. It's about healing, it's about wellness. And we have developed this model over 55 years. The program is here since 1968. It began with a pediatrician half-time and a social worker full-time. And we have grown to be what we are today. We are very, very large in the business that we are in. The program is designated as a medical home for youth by the federal government at a very high level in terms of the quality. It is a youth-specific, meaning that all that we do is we work with youth, ages 10 to 26, and it's a youth-friendly model, meaning that we really sit with young people to understand their needs, to understand what is it that they want, to understand what are potential barriers that are going to keep them away, what are potential facilitators that are going to make it easy for them to come in. And we design the services like that. It's about the young person, not about us, the staff, not about the hospital, not about the finances. It's how do we create a system of care that young people want to come to and actually get what they need in a timely way. This model is designed to meet the developmental needs of youth. So as I mentioned to you, we work from age 10 to 26. Obviously, a 10-year-old is not the same as an 18-year-old or a 24-year-old. So we work with them developmentally, whatever they are, and with that understanding of adolescent development. And this program can be adapted to the specific context, different part of the country, whether it's rural or urban, different populations. So, what really matters are the philosophy, the principles of the work itself. This is a picture of the integration of the model. It's complex. So we integrate in a number of ways. We integrate services, which is, I see services as our main thing. That's what we are here to do, to provide access to what the young people need. But we also do training. We train people in medicine who are already pediatrician, internists, or family physicians, or med speeds, which are a combination of pediatrics and internal medicine, to become experts in adolescent health and working with youth. We also do research, but the research that we do is not just to publish. We do publish, but the research is also to find out how things work best for young people, how we need to refine our approaches, and different type of things like that. And all that is integrated. Everything is in one side, basically, and the training is done in the clinical site. The research is integrated into the clinical site without losing the vision that young people are coming here for services. I'm a scientist, but I'm very clear that I'm a clinician, and that the youth need to come here and have their need met in a timely way. So that's one integration. Another integration, as I mentioned before, is advocacy and policy, because I'm very interested in serving the young person here in front of us, but at the same time, how do we work with the systems to make them easier for young people, whether it's financing, whether it's making it easy for them to get the insurance that they need. Or to give you an example, in New York State, adolescents have the right to being screened, treated for sexually transmitted infections, but they confidentially, but they didn't have the right to get the vaccine for the human papilloma virus without parental consent. So we work with the state, we work with the government, we work with everyone, and eventually a bill was introduced that allowed young people that need to get their vaccine confidentially to get it. Most kids or parents bring them, and that's not an issue. But other youth, for whatever reason, need to have that ability to get their vaccine and prevent those infections when, for whatever reason, their parents may not be able to bring them or involve or things like that. So we work on those things also. In terms of the actual clinical services, we have an integrated model of physical health, sexual and reproductive health, dental, optical, health education, behavior and mental health. I often say from head to toes, from mental to dental, and everything in between. And so you can see how extensive those services are for medical. The youth have access to us 24/7, 365 days per week. The clinic is open physically Monday through Saturday, all day. And then when we're not here physically, we have a senior physician on call to receive the call from the young people and determine what needs to happen with that. And the sexual and reproductive health, that go from am I gay, am I lesbian, I'm transgender, I'm having unprotected sex, I need family planning, I'm pregnant. So the full range of things that young people may need and request, we try to provide that here. They have access to the full range of FDA approved family planning methods when they need that. And the mental health, we have a very robust mental health program with social workers, psychologists, child and adolescent psychiatrists, and we provide the youth get intake and assessment, and then once that's done, they get assigned for individual psychotherapy to a person who's a good match for them, and then they come weekly. They determine what time to come for that. We also do group therapy. And the group therapy sometimes is, for example, around an issue for youth who are HIV infected, or youth who are survivor of incest, or different type of being a teenager who's 15, adolescent issues. So all type of groups we do. And we also do family therapy, because sometimes we work with the youth, but the dynamics are at home. So we need to, whenever possible, the youth is able and willing to ask the family to come in, we work with the entire family. And sometimes the youth is all in all these three modalities at once. We also do, the youth, if they need to see a psychiatrist, they see a psychiatrist. That could be for a psychiatric evaluation. That could be because they need medication. And we have psychological services. So the psychologists, they do therapy like the other providers, but they also do psychological evaluation and psychoeducational evaluation to see. Sometimes the youth may not be doing well in school, but people don't know why. They think the kid is not doing the work or whatever, but it is that the kid learn differently. And no one has been aware of that. So we do the evaluation. And then because we have lawyers here too, between the psychologists and the lawyer and the parents, we advocate in the Department of Education for this young person to be taught the way that they learn. And then we do a lot of work around trauma and violence and that. We have a number of specialized programs for certain population or issues, and everything is integrated. But we do, many of our youth have trauma, 70% have a history of trauma, complex chronic trauma, including about a quarter with a history of sexual abuse, mostly incest. In addition to that, then rape and acquainted rape and sex trafficking. I mean, I can just go on and on. It's a highly traumatized population. Our youth also, some of them do substance. We have other type of programming, like if they are pregnant, we have a youth-specific prenatal program. We have a youth parenting program that I mentioned before, where we see them as a family unit. And then we have our own services for HIV positive kids. We don't send them to an AIDS clinic. We have the expertise to do that here, the same way that we have the expertise for transgender. So in addition to the big center, that is when I show you in the map, we have full-time clinics inside 6 high school buildings throughout Manhattan. And through those we serve 23 high schools and middle schools right on site where the kids are. They come to the clinic. If they have asthma, we give them a nebulizer. We send them back to class so they don't waste, they don't miss as much school. And we give them their mental health back to the classroom. So I think it's a wonderful model to have school-based services. But you also need to have the community-based services, because not everyone in school, and also because of the age. Obviously, high school, they usually are graduating 18, 19. And we have the optical services where they get glasses, free glasses. So everything is free. We also have a lot of youth leadership programming. So we have the youth get trained on they are leaders, they are peer health educators, they work with other youth in our program, they work in the community, they go through our schools, and they learn not just the content of what they actually are working with other youth, but also how to do presentation, how themselves, how to, all type of things they learn. So it changes their lives, and they help change the life of their youth, and the youth listen to them. They become like the, people in their community that people go to or in the school. So this is that. So it's a very comprehensive model. We can discuss this further as well. We have, in terms of mental health, I don't know what it's called there, or I know you have people from different states, but in New York, they call the mental health, the way of providing mental health, either Article 31, that is the more traditional. Everything that we do is youth specific. We only see youth. But in the Article 31, the youth come for an intake, they get an assessment, they get assigned to a therapist, they come weekly if that's what they're going to do. So we have that. In the Article 28, what we did, and I began this probably like 25 years ago, was that I developed a behavioral and mental health service within the medical, integrated with the medical. Everything is integrated, including the Article 31. But in the Article 28, we have mental health professionals with flexible schedules. So when the youth come for a medical appointment, they can come for a physical, they can come because they have a cold, they can come because they were just raped, they can come because they are going to college and they need something. When they come to the medical visit, they can see that same day a mental health professional. And I did this because way back, I realized that some of the youth that we were connecting to our Article 31, they were not able to always make it. For example, homeless population or people who are being sex trafficked. The young person is not going to say to the trafficker, I have my 2 p.m. Tuesday appointment at Mount Sinai, I will see you later. That's just not happening. But they will come for something medical. They come because they think they are pregnant, or they may have a sexually transmitted infection or something. They have a rash. And then when they come for that, we talk with them about their life and how they feel and what's going on and all this type of thing. And if we see any indication that they can benefit from mental health and they are willing to, that same day, we have these mental health services on demand that can see the youth that same day. And for the youth who are being sex trafficked, for example, every time they come for something medical, they get one shot of mental health. So we try to work with them like that. And eventually, hopefully, when they, when they're out of the life or whatever, they can come, any one of them then can come to the Article 31 that has much more of a structure. But we try to just provide those services the way that they can utilize and as much of it as they can tolerate in one day. So this is in the Article 31, and I mentioned some of this. We do all this type of services. Again, very comprehensive. You know, the psychoeducational evaluation, I don't know in other states, but in New York, that costs thousands of dollars to get a psychoeducational evaluation. And I just felt that these kids needed to have the ability to get a good one to determine where they, the way that they learn. So they get it, they're getting that here as part of their services. This is the Article 28 that I mentioned, that is mental health on demand when they come for the medical or sexual and reproductive health services. Very easy, seamless. You know, we all work together. We have about 16 different disciplines and we all work together. And I want to talk a little bit about stigma. We have a program that we call Adolescent Health Center, even though at this point should be adolescent and young adult health center. When we began, it was just the adolescent years, but we have expanded the age. And the reason that we do that, and we don't call it a mental health clinic or a family planning clinic or an HIV clinic, is because we want to remove the stigma. No one knows when the kids come through our door why they are here. They sit next to each other in the waiting room. No one knows. People just know behind closed door when they are with their clinician that we know exactly why they're here, and we try to meet their needs. So these are the most frequent diagnoses in mental health. A lot of stress, a lot of trauma. As I mentioned, 70% of the youth have a history of significant trauma, post-traumatic stress, anxiety, self-harm, isolation, depression, suicidal ideation, and substance. These are some of the most common things that we see. And these are some of the modalities that we use in the work. So we provide, many of the so-called evidence-based cognitive behavioral therapy, trauma-focused cognitive behavioral therapy, dialectical behavioral therapy, the eye movement desensitization and reprocessing, EMDR, We also do, especially in the parenting program, the child parent psychotherapy. We do art therapy, we do music therapy, and we do the more psychodynamic therapy. So we use different modality, and the kids get what they need. This is just so that you get a sense of how the place looks. So we have things that are color coordinated. So you can see on the left, the green area, the floor, the tiles are green, the chairs are green, the wall is green. So we can say visually to a young person, go to the green area. And on the second here, the second picture on the right, you can also see the yellow area. The tile are yellow, the chair are yellow, the wall are yellow. So it's just easily visually to the youth to know exactly where they are going. All the art on the wall are done by our young people. We we do programming with them that we buy camera and we give it to them, and we bring professional photographers to help them learn the skill of photography. But then we use the photography to learn about their lives and for them to express themselves. We do an opening gallery so that they invite their family and friends so that they get positive attention, because sometimes our youth, especially because they are youth of color, the attention that they get is very negative and people really do not see them. Here they get seen, they get really, they are the center of the event and in front of everyone. This is one of our doctors, Dr. John Stever. He's an adolescent medicine physician. Many of us are, that's our training. He also has tremendous expertise on transgender, HIV, in addition to everything else that we do. We do everything as an adolescent. And this is one of our young people. Here we have Marisela, and Marisela is a medical assistant with one of our young patients. And you see, the people are just have great energy. The kids are wonderful. In addition to the more other services that we do mind-body work. So this is a room, we call it a gym, but it's just a room with a dance floor. So the kids can come and dance hip hop, they can dance Zumba, they do whatever. They can also do yoga. It's a large room that we have, and it has mirrors. They can look at themselves. They can do whatever they would like. So, everything that I mentioned is about justice. So because we believe in justice, we do not exchange money with any young person. You saw when I show you that most of them are low income, most of them have no insurance at all or underinsured. So everything is at no cost. We don't exchange a penny with anyone, even when the person is wealthy, the young person, because we feel they have the right to come here and get whatever it is that they need. We pay for all their services. We pay for all the laboratory tests. I will say like 98% of the medications, and we give them Metro cards, which is what is used in New York City to get in those subway and the buses for transportation. And we feel that this removes the economic barriers that many people have that make it hard for them to go for any type of services. The staff that we have is majority people of color. We have all type of staff. I mean, white, wealthy, low income. They come, a whole bunch of people that have come from around the globe, from Russia, from, all type of people. And this facilitates our youth to really feel reflected on the staff. The youth love their staff, their clinician, whichever way they look. They love that person. They love Dr. Stever, for example. But we also want them to see people that look like them, that can be health educator, that can be social worker, that can be physician, that can be whatever, so that it gives them that inspiration and sort of show them possibilities. So we do that. And the staff, we provide services in many, many languages because we have those languages in the staff. But if we don't have a language, we get someone, a professional translation system to do that. It's always better when it's one-to-one because we deal with confidential issues, but sometimes, there are languages that we just do not have. This is the staff. And here you have the rainbow. Here you have some of the staff are, you can see in terms of the race, ethnicity, the age. We have here gay, lesbian, transgender, you name it, we have it. So it's a very diverse staff. And I think the age here is probably from the 20s to the 80s. Somebody sitting there is 80. So, and it's just wonderful because it's really an incredible, committed, energized, passionate people who are highly skilled in all type of things, 16 different disciplines. These are just, I mentioned just some additional services. We do tutoring for like academic, when the kids need tutoring, we do that. We help them with SAT prep. So being in school and do well in school is my number 1 outcome. Even though I know this is a health clinic, we know that if the youth do not get to graduate from high school and our youth, many, over 90% graduate high school and over 50% go to college, 2-year college, 4-year college, graduate school. Some of them come back to the program to work in all type of thing. I mentioned the mind-body programming and also healing through the arts, which is photography and music and that type of thing. This is things that we do, integration, like I mentioned some of this before. We have a sort of public health and clinical approach integrated in a way that usually you don't see. We did a lot of work with research about COVID-19 and the impact that COVID had on our youth. And then we have the peer health educator. They also do mapping projects in different communities. They get to know the community. This is me with the youth in the community. And we have partnership with over 100 community organizations, and they may do after school tutoring or sports or, art, but it's really hard to do health because it's very expensive and very, it's just hard to have. So we do that, we partner with them. And we see the youth as our partner. As someone said before, that young people are really the experts of their own lives. It doesn't matter that I'm working with them for 40 years. They are the expert of their own particular life. So we use their expertise to inform everything that we do, from the design and the planning of the services, feedback, and also when they come for their visit, after every visit, we want to know how it went and what will they change. And then we have we do campaign that they do and they run. They did that during COVID about people not being alone, not feeling so alone, and they were sending messages of companionship and hope. We did a whole campaign about youth coming for vaccination when people didn't want to get vaccinated. And if you ask a youth, why do they come here? If you ask me, I would say, we do these amazing services that are youth specific. The young people say they come here because they feel welcome, respected, connected, safe, not judged, and that their needs are met. So if they come with a pimple, we don't say, oh, that's not a big deal. Even if we think that we find out that they have all these other type of issues, we make sure to treat that pimple because that's why they came. So we meet their need, and then we figure out what else do they need. How can we engage them in other type of services? And I want to show you a video, if I can figure this out, of some of our kids so that you hear from their own voice why they come here.
It's not as nerve-wracking, like there's not a bunch of people. It was very quiet, and when you go to the front desk, there's not really like, what do you want? She was like, oh my God, hi, how's your day? And I was like, oh, you care, okay. So it was comforting. When they called my name, I just went straight to the back where the doctors were. They took my blood pressure and everything. Even the nurses were nice. And it's good that they like their jobs because you could feel that vibe. From anybody, you could feel that vibe. It was very comforting, and I got shots. That was awful, but with a smile on their face, it made it a little better. I was with the doctor in the room, and I saw a counselor after because I got an HIV test also, and they have a counselor for that. And I thought that was awesome that they asked me, questions about my personal life so they could see where my mind is at, even if the test was to come out positive, like where my mind would be. And I don't think I saw that in any hospital before. Everything that the clinic has to offer, the counseling that they would give you if you have a problem, the physical that they can give you for free, the dental that they can give you for free, the obstacle place that they can give you for free, stuff like that is hundreds of dollars that your parents would have to pay for. And even if you want to come to the clinic and don't want to tell your parents, it's confidential, and I think that's the safest way to get somebody to be open about themselves and be comfortable. I saw a doctor. They did all my checkups, my physical. By less than 2 hours, I was out in the street already, back doing whatever I had to do for the rest of the day.
I came to the center exactly 5 years ago. I was 17. I was going through quite a depressive relapse at the moment, and I was self-harming for quite a few years. And by the time I turned 17, I felt like I didn't want to keep living my life that way. I kept thinking, I can't make it through another night like this, and I decided to take a step forward. I've seen my social worker, Lily Divino, for those 5 years, and the way that things have changed has been tremendous. I honestly don't think I would be here if it wasn't for that. I would not have stopped self-medicating. I would not have stopped cutting if it wasn't for the help and the support that's given to me here every week, without question. You come here and the first thing that they will tell you, is this is between us. This, whatever is said, is here between us two, and that's such an important part. After I came out, my family situation was very difficult. When I mentioned it to Lily, she suggested coming for family therapy. My parents got to know Lily. She's a household name now. We all know who she is by first name basis. My mother has her number. That's how connected we became. I think the best way to describe the center for me and what it's like to be part of the center is very safe, very empowering, and very supportive more than anything. From the moment you come in through the doors, every single person in that building has been so sweet to me. This place has shown me what it feels like to have hope and to have a safe haven and to feel like I'm not alone. And for that, I'll be eternally grateful.
After this one, I have one more.
I regularly donated blood, and there was actually a mobile blood bank that was coming by my school at the time, and I donated blood. A couple weeks passed, and then I actually got a letter in the mail saying that I had to go to the blood bank in Midtown because they had to tell me something about my blood. It was pretty obvious what it was, honestly, when I received the letter, but I went anyway. And then they told me the news that I was HIV positive, and they gave me a list of possible hospitals with programs that could help me kind of do what I had to do as far as HIV was concerned. I actually went to the Adolescent Health Center because I saw that it was tied to Mount Sinai, and on top of that, it was actually as furthest away from Queens as I could possibly get, which is where I'm really from. I was still kind of unsure what HIV was, so I didn't want to bump into anyone that I potentially knew or anything like that. Honestly, the first time I was there was kind of intimidating. I couldn't even bring myself to say HIV. It was something that was just, the words didn't even want to escape my mouth. Just seeing how I was treated by Dr. Francis, Tara, Maya, a level of comfortability developed. Mentally, I was kind of all over the place. I wasn't out, I didn't really have any direction. I felt lost, for lack of a better word. What the AHC helped me with was direction, honestly, not only with being positive, but this direction in everything in my life. They didn't let me get away with just good enough. I graduated cum laude 3 years from a reputable school, and now I'm in grad school. I have a great job. And this is thanks to them, because easily if I fall into, I feel, a bigger system, I would have fallen through the cracks, and yeah, I would have been on pills, but that's just about it. Like, I wouldn't have wanted to do better for myself. Project Impact is an HIV positive group that services teenagers up to the age of 24. It has such a wide range of people. You'll have someone who's 14 just dealing with high school things, and then you'll have someone who's 20 currently having issues with housing. I could think of one example, someone who I do know in Project Impact, HIV positive, thanks to Hausa, ended up being able to get a place by himself, live comfortably, get a job, and just lead a normal life. And if it wasn't for Project Impact putting him into touch with Hausa and programs of the sort, he would probably still be homeless. That's what Project Impact offers people who are HIV positive and under 24, honestly, just direction when there is none. After getting my MBA in marketing, I'm actually looking forward to potentially working for a pharmaceutical company that develops HIV drugs and kind of just continuing being part of this, you know? I don't want to just become someone who happens to have HIV. I want to be an advocate for it. I want to show people the same way the AHC showed me that that's not a hindrance. If anything, it's a tool to your advantage.
And this is the very last one.
There was a time in my life where I was facing something like domestic violence, and I like keeping my personal stuff personal. So I came in and Julie noticed I was kind of sad. She asked, "Is everything okay at home?" And I told her, "Yeah, everything's okay." But she already knew who I was, and she knows I'm a happy person all the time. And she says, "I don't think everything's okay, but are you sure everything's okay?" So I just I trusted her, and I vented out. I told her everything, what was going on at home, and she referred me to Trisha, and I spoke my heart out to Trisha, and she helped me so much.
We worked on trying to make home safer and trying to figure out what steps she needed to take in order to make sure that she and her child were safe.
She made me feel the comfort that I needed to have at the moment, and she made me feel that everything was going to be okay. And ever since that day, I've been so thankful with Trisha.
I work in the mental health clinic and in our teen parent program. And in the teen parent program, I work with moms of all ages.
He loves his iPad, and I didn't know how to get him off of that. So with Trisha, she taught him how to color and all those things, and now he loves coloring. Every time we go to Target, he wants a box of crayons. So that's good.
Often we'll get teenagers who have gone to other clinics where they have felt shamed for being a parent. I'm horrified to think of what that must be like for them. So here we try to just celebrate them being mothers, celebrate the joys of watching their children grow and develop.
It was a Ben's decision to come to this clinic because I feel like there's no other clinic like this. And every time I talk to my friends about this clinic and I tell them, hey, it's a great clinic, and you know, the social worker Trisha helps me out through any situation that I have at home, school, my job, anything. If they ever do think about stepping in here, they won't regret it. It'll be a great decision.
So thank you so much. That's what I have.
Dr. Diaz, we had a few follow-up questions for you, if that's okay.
Sure.
Okay. One of the questions was asking, how do we reach parents to help them understand that talking about physical and mental health issues will empower youth with informed choice and not encourage youth to participate in the harms they'd like to spare youth from?
Yes. So for one thing, we do confidential services because we think they are important to help the young people come in. But once we start working with them, we ask them about their relationship with their parents, and we try to help them if they don't have a good relationship to build that. And sometimes the youth may say, "Oh, my parents will kill me if they know I'm gay." And we say, "No, bring your parents. We will sit down with you, and you will tell them here." And and also we do family therapy where all the family members, whoever they consider a family, can come in. We work together with them. We do groups for parents, let's say the parents of transgender youth, to understand their kids, to love their kids, to support the parents. If the parents need some words on how to best to communicate with their youth about different things. So we know that youth do better when their parents are involved and when their parents love them. It's just that often, even if it's that the youth love their parents, they feel that they don't want to disappoint them. And if they don't have confidential services, they may not come. So I think eventually this type of model leads to enhanced family communication.
Thank you. One more question around funding issues and how you navigate funding so that you can pay for things like Metro passes and other resources for young people.
Yeah, so the youth that have Medicaid, that is about 1/3 of the youth, we bill Medicaid because they paid us directly. They paid the hospital directly without sending home any document that the youth was seeing or for what. We don't, usually the private insurance, we don't process because they send things home. And then we are very entrepreneurial. So we also do events. Like for example, New York City has a marathon. We have a team that runs a New York City marathon to fundraise for us. We give them the spot, but they fundraise for us. We do an event every year that we call the Breakfast of Legends. So we honor people that have been wonderful with youth or wonderful with our program or more generally. And I always say it's the most expensive bagel in the universe because the minimum ticket is $400 and we give them a bagel and lots or whatever. So we are just very entrepreneurial. So we raise money. And I also meet with individuals. And when they understand the mission, what is it that we are trying to do and the impact that the program has, people are very, very generous. And that goes individual or foundation. We also write grants to the government, New York State government. And sometimes the funding is very silos. I may get a grant for, let's say, family planning, a different grant for rape, a different grant for sexually transmitted infections, and so on. And you have to really be creative because these are the same youth. How do you make this funding work in a way that is best for the youth? So we are just, we are very entrepreneurial in that sense.
Thank you so much, Dr. Diaz. I always love learning from you and hearing about your fantastic program and your passion and how you've utilized policy to create change for the young people that you work with. We're really grateful for you making the time.
Thank you. And I just want to share that I actually was a youth, like the one that come here. I was a high school dropout. I had depression. I didn't leave my house for months. And when I came to this clinic, they treated me with a little bit of mental health at the right time. And I was able to go to high school, then college, medical school, and then I came back. So I know firsthand how a youth getting the right, help at the right time can do. You can go this way or you can go that way. So, that's why we love the work that we do. And we see the impact. It's transformative. I mean, the young people are so courageous, so strong, so smart. And we just partner with them to make sure that doesn't go on the wayside. Thank you. Thank you for having me. And good luck with your conference.